My name is Bruce Porter. I'm a physical therapist working on my doctorate with ATSU. Today we're going to have a patient, a case study, who was a 35-year-old police officer who had multiple injuries to her right lower extremity. We're going to look at her limitations, which are primarily in range of motion. We're going to glide through quickly through grade 1 and 2 of the mobilization techniques and get to grade 3 and 4 in the 3 joints that have been affected by her injuries. And I want to start by letting my patient know that I'm going to be working up high in your joint line here, so be aware of that, and if it becomes too much, you can let me know. But we're going to start with some techniques right here. This is the gapping technique Dr. Hodges described. I'm going to get my hand high on your joint line and use my body weight to distract this, a lateral distraction that she called gapping. And you let me know if you have any discomfort with this technique. Okay, and we're going to also include using the bells. All I have is a couple of gate bells here, so I'm going to have to try to make this work. Wrong way. And this way I can use my body weight to provide a little more distraction at the hip, and that would allow me to have freedom to perform internal rotation. So I can use my body weight to kind of lean back and get grade 3. This is not ideal, but we're getting grade 3 here and then moving into grade 4. You okay with that? Okay, and then of course, since she has physiological limitations of internal rotation, we can move into a little physiological internal rotation here. My belts are not quite right, but this would be leaning back again and getting my body weight to provide that force to get that rotation. So, internal rotation. So that's all we're going to do in supine at the hip. At the knee, we're going to do, I liked Dr. Hodges' idea of having the knee up like this to provide a firm support. And again, as she had, it puts too much of an angle, so we're going to go like that. I'm going to provide, since we have a knee limitation of decreased flexion, about 25%, this force of anterior to posterior movement, I'm just going to use my one hand. I know Dr. Hodges used both hands. But I'm going to provide just with that one hand like that. And then we'll get a little rotation at the end range to get a little medial rotation. So I'm moving her knee inward. Any discomfort with that? And to be realistic about it, I would actually, if that went well with my patient, which it clearly did here, I would put her in prone and progress it to the next anterior posterior in physiological flexion, which we'll do here in a moment when we go over into the rotated position. Next thing I wanted to address is the patellofemoral joints. I'm going to leave this like this. And the patient had limitations in that we had medial limitations, so we're going to have a grade 3 mobilization medially. I want to do it this way and rather than using my thumbs because I don't have very strong thumbs, so I'm going to use the heel of my hand medially. Are you doing okay? Okay, so I got grade 3 and I'm going to move into a grade 4. It's going to be end range against resistance, several mobilizations like that. The next one we want to do is an inferior glide, which I would do, I think I'll do it with my left hand. So we'll do it like this, and Dr. Hodges described getting a little bit of a lift, which I feel like I am getting a lift on this, a little distraction away from the condyles. All right, that hurt? Okay. Okay, so that's the second glide, and then we're going to do a combination of those two, moving in this direction, this limitation, use my body weight as much as I can here, like that. Okay. So those are the mobilizations that I wanted to do in supine. So can you roll over for me? We're going to do this. Normally I would have my patient reverse ends, but then we got camera issues, and we'll just do this way, and I'll reach out here. I realize this is not ideal for my body mechanics, but again, we've got limitations in extension at the hip, so we want to get that arc of motion of moving. So I'm pushing in kind of an arcing direction, and I'm lifting in an arcing direction this way. Move into my grade 3s. And you tell me if you have any discomfort with this. Move into my grade 4, and grade 4 is more difficult to really know where I am in these because of that soft tissue. All right? Uh-huh. Okay. Okay, so that's what I'm going to do there at the hip. For the progression of the anterior posterior to try to increase flexion of the knee, I'm going to come here like this, and I can get much greater force in this angle. Plus, I'm closer to the physiological flexion where her limitations really are. So we've got this. I'm getting that. I'm going to do grade 4, end range. You okay?
Yes.
Okay, so we're doing those. Then we're going to move to the ankle. This one we had limitations of both plantar flexion and dorsiflexion. So I'm going to come here distal to the malleoli and try to mobilize, and we can do flexion with this. You all right?
Yeah.
Okay, so we're moving like that. That's my to increase plantar flexion, which we really have limitations here. For dorsiflexion, I'm going to go anterior posterior with my grade 3, grade 4s. So like this. Okay. Move into dorsiflexion as I do that. That's it. I think that's the limit of what I wanted to do. Thank you very much. We'll see you next time.